Dr. Quinn, any surprise in the case numbers that came out today?
Not at all, not at all. I actually had a telephone meeting with Dr. Dobbs, the state health official here in Mississippi last week, and he confirmed that the cases are going up. Now, the deal is what he told me was most of these cases, 80% were the Delta variant. But he also told me that there's about a 2-week lag as far as when they do the testing. And this testing is done at the Mississippi Department of Health and at UMC. And it takes about 2 weeks before they catch up. So he felt very confident that we're probably at about 90% right now with that Delta variant. And it's much more infectious, and it looks like it might be more virulent as well.
Dr. Quinn, you at your clinic, what are y'all seeing? Is this backed up by the cases that are going on where you are?
Oh, yes. I mean, we're seeing it everywhere, even right here at Quinn Healthcare. I mean, every doctor, all my colleagues, were talking amongst one another, and we're very alarmed. Now, the deal is we're actually doing the treatment here at our clinic. We're doing the monoclonal antibody treatment because we're part of the Eli Lilly trial, and we're doing so many patients. It's so busy right now. It's really a bad time in Mississippi and all over the world because we're in the fourth wave, and we really need to start sounding the alarm and getting people vaccinated.
Now, the American Academy of Pediatrics says that all school children should wear masks regardless of vaccinations. Your thoughts on that and the guidance on that?
Well, here's the deal. People are getting vaccinated, and we have to just keep pounding the drum, getting people vaccinated. But the problem is with this new Delta variant, we're seeing people that have gotten vaccinated and they're still getting coronavirus. Now, the good news is if you've been vaccinated, the science is showing that you do better if you get coronavirus, meaning you don't get as sick. We've had a lot of people to contract coronavirus, but when they were vaccinated, they just had some mild symptoms. But the problem is they can spread it to others. That's why the American Academy of Pediatrics is recommending to wear that mask, because now, even though if you've been vaccinated, you can still spread it. And as we've seen in some of these children, it's much more virulent. They're getting more sick, with 7 kids in the ICU right now.
Wow. Wow. So you're talking about people who have been vaccinated are at risk again. So how at risk are unvaccinated children right now?
Well, even more. I mean, the deal is right now we can vaccinate children 12 years of age and older. I recommend everyone get your children vaccinated, because what's happening is, and I talked to Dr. Dobbs, we had a really, really interesting conversation. Children were getting coronavirus infections early in the pandemic, but they weren't getting as sick. But now with this new Delta variant, and this is a mutant strain, I mean, basically if somebody gets coronavirus and they develop these new variants, this Delta variant is making children even more sick. And as a result, we have all these children in the ICU, and we haven't had children hit this hard before. So we really need to be aware of what's going on and stay on high alert, because it looks like it can be getting a little bit worse right now.
Yeah. Thank you for joining us. By the way, Dr. Quinn, I've been seeing you on News Nation on WGN in Chicago. I want your autograph, buddy.
Hey, thank you. We got to keep fighting.
Yeah, it is. It's an important thing. It really is an important thing right now, is it not?
Yes, sir.
Okay.